Comprehensive NCLEX RN Challenge Exam 14. Question 1. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for depression and suicidal ideation, tachycardia and diarrhea, muscle cramping and abdominal pain, tachycardia and euphoric mood. Withdrawal from barbiturates is life-threatening and characterized by severe physical symptoms including muscle spasms, tremors, and abdominal pain. Question 2. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Right breech presentation, right occiput anterior presentation, left sacral anterior presentation, left occiput transverse presentation. Fetal heart tones heard in the upper quadrants of the abdomen usually indicate a breech presentation. Question 3. The primary physiological alteration in the development of asthma is bronchial inflammation and dyspnea, hypersecretion of abnormally viscous mucus, infectious processes causing mucosal edema, spasm of bronchial smooth muscle. While asthma is a chronic inflammatory disease, the acute clinical manifestation is primarily caused by the spasm of bronchial smooth muscle, bronchospasm. Question 4. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should serve high-calorie food she can carry with her, encourage her appetite with favorite foods, serve her small, attractively arranged portions, allow her in the unit kitchen for extra food. Clients in a manic state are often too hyperactive to sit for meals. Providing high-calorie finger foods allows them to eat while on the move. Question 5. To maintain Bryant's traction, the nurse must make certain that the child's hips are resting on the bed. Hips are slightly elevated above the bed. Hips are elevated on a pillow. Hips and legs are flat on the bed. In Bryant's traction, the child's buttocks should be slightly elevated off the mattress to provide the necessary countertraction. Question 6. Which action by the nurse indicates understanding of the care for a client with herpes zoster? The nurse covers the lesions with a sterile dressing. The nurse wears gloves when providing care. The nurse administers a prescribed antibiotic. The nurse administers oxygen. Herpes zoster, shingles, is transmissible through direct contact with the lesions, therefore, gloves must be worn during care. Question 7. A trough level is ordered for a client receiving vancomycin. The nurse should have the blood collected 15 minutes after the infusion, 30 minutes before the infusion, 1 hour after the infusion, 2 hours after the infusion. Trough levels are drawn when the medication is at its lowest concentration in the bloodstream, which is typically 30 minutes before the next dose. Question 8. The client using a diaphragm should be instructed to refrain from keeping it in longer than 4 hours. Keep the diaphragm in a cool location. Have it resized if she gains 5 pounds. Have it resized if she has any surgery. Diaphragms should be stored in a cool, dry place to prevent the degradation of the rubber or silicone. Question 9. Which statement by a mother planning to breastfeed indicates the need for additional teaching? I'm wearing a support bra. I'm expressing milk from my breast. I'm drinking 4 glasses of fluid during a 24-hour period. I'll allow the water to run over my breasts in the shower. Breastfeeding mothers require significantly more hydration, typically 8 to 10 glasses of fluid per day, to maintain adequate milk production. Question 10. Damage to the 7th cranial nerve results in facial pain, absence of ability to smell, absence of eye movement, tinnitus. Damage to the 7th cranial nerve, facial, affects facial expression and taste. However, it is frequently confused with the V nerve, trigeminal, which causes facial pain. Question 11. A client is receiving pyridium for a urinary tract infection. The client should be taught that the medication may cause diarrhea, change the color of her urine, cause mental confusion, cause changes in taste. Phenazopyridine, pyridium, is a urinary analgesic that typically turns the urine a bright orange or red color. Question 12. Which of the following tests should be performed before beginning a prescription of Accutane? Check the calcium level. Perform a pregnancy test. Monitor apical pulse. Obtain a creatinine level. Isotretinoin, Accutane, is highly teratogenic. Female clients must have a negative pregnancy test before starting therapy and use strict contraception. Question 13. Which nursing intervention is most critical during the administration of acyclovir, Zovirax? Limit the client's activity. Encourage a high carbohydrate diet. Utilize an incentive spirometer. Encourage fluids. Acyclovir can cause renal damage due to crystal formation in the kidneys. Maintaining high fluid intake is essential to prevent nephrotoxicity. Question 14. A client is admitted for an MRI. The nurse should question the client regarding pregnancy, a titanium hip replacement, allergies to antibiotics, inability to move his feet. The nurse must verify the patient's pregnancy status and the presence of any ferromagnetic metal implants before an MRI. Question 15. The nurse is caring for a client receiving amphotericin B. Which finding indicates toxicity? Changes in vision, nausea, urinary frequency, changes in skin color. Amphotericin B is highly nephrotoxic. Changes in urinary output or frequency can indicate early renal impairment. Question 16. A patient with congestive heart failure complains of dyspnea. Which action is the first the nurse should perform? Ask the patient to lie down. Draw blood for ABG. Send the patient for a chest X-ray. Check blood pressure. When a patient is in respiratory distress, the first priority is to assess vital signs to determine the patient's current clinical stability. Question 17. A patient prescribed nitroglycerin for angina complains of frequent headaches. Which response is correct? Stop taking the nitroglycerin. Go to the emergency department. Headaches are a frequent side effect because it causes vasodilation. The headaches are unlikely to be related. Nitroglycerin is a potent vasodilator. Headache is the most common side effect due to the dilation of cerebral blood vessels. Question 18. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which explanation accounts for this? The symptoms may be from anemia caused by chemotherapy. The patient may be immunosuppressed. The patient may be depressed. The patient may be dehydrated. Chemotherapy can cause lingering bone marrow suppression, leading to anemia which manifests as fatigue and chemobrain difficulty concentrating. Question 19. A clinic patient has a hemoglobin of 10.8 g/dl and is a strict vegetarian. Which advice is appropriate? The diet provides adequate iron. The patient should add meat to her diet. Use iron cookware and eat dark green, leafy vegetables. Add a cup of coffee or tea to every meal. Vegetarians can obtain sufficient iron by consuming non-heme iron sources like legumes and leafy greens and using iron cookware. Question 20. Which is the most accurate statement regarding a PRBC transfusion? Reaction is most likely after infusion is complete. PRBCs are best infused through a 20G catheter. PRBCs should be flushed with 5% dextrose. A nurse should remain in the room during the first 15 minutes. The first 15 minutes are the most critical for identifying life-threatening acute hemolytic reactions. Question 21. Which patient at triage should be assigned the highest priority? Patient with low-grade fever and myalgias. Patient unable to bear weight on the left foot. Patient with abdominal and chest pain after a spicy meal. Child with a 1-inch bleeding laceration on the chin. Chest pain must always be treated as a potential myocardial infarction until proven otherwise, making it the highest triage priority. Question 22. A patient has a calcium level of 6.0 mg/dl. Which symptom would you not expect to see? Numbness in hands and feet, muscle cramping, hypoactive bowel sounds, positive Quast-X sign. Hypocalcemia, normal 8.5 to 10.5, causes neuromuscular irritability and hyperactive bowel sounds. Hypoactive sounds are seen in hypercalcemia. Question 23. A patient has an ing tube attached to low suction. Which ABG result might be expected? pH 7.52, PCO 54 mmHg, pH 7.42, PCO 240 mmHg, pH 7.25, PCO 225 mmHg, pH 7.38, PCO 236 mmHg. Loss of gastric acid via suctioning leads to metabolic alkalosis, elevated pH, with a compensatory increase in PCO2. Question 24. A patient scheduled for surgery is taking a high dose of warfarin. The nurse anticipates which action? Draw blood for point and INR level. Administer vitamin K. Draw blood for type and crossmatch. Cancel the surgery immediately. The surgeon needs to know the patient's current coagulation status, point/INR, to determine if it is safe to proceed with the procedure. Question 25. Which of the following laboratory results are abnormal? Select all that apply. Hemoglobin 10.4 g/dl, total cholesterol 340 mg/dl, total serum protein 7.0 g/dl, A1C 5.4%. A cholesterol level of 340 is significantly elevated, normal 200. Hemoglobin 10.4 is also low, normal 12 to 16. Question 26. Which statement about juvenile idiopathic arthritis is most accurate? Poor chance of recovery without deformity. Most progress to adult RA. Non-steroidal anti-inflammatory drugs are the first choice. Physical activity should be minimized. NSAIDs are the primary first-line treatment to manage the inflammation and pain associated with juvenile idiopathic arthritis. Question 27. A child has a puncture wound and suspected osteomyelitis. Which action is done immediately before the antibiotic is started? The admission orders are written. A blood culture is drawn. A CBC with differential is drawn. The parents arrive. Cultures must always be obtained before the first dose of antibiotics is administered to ensure accurate identification of the pathogen. Question 28. A 2-year-old child refuses to walk and has a swollen leg. Which does the nurse suspect? Possible fracture of the tibia, bruising of the gastrocnemius, possible fracture of the radius. No anatomic injury. Swelling and refusal to bear weight in a toddler's leg are classic indicators of a toddler's fracture or tibial fracture. Question 29. Which information should the nurse provide to the parents of a child with cerebral palsy? Regular screening is important for secondary delays. CP is caused by injury to upper motor neurons. Milestones will require no intervention. Outdoor activities are prohibited. Cerebral palsy is a motor dysfunction disorder resulting from permanent, non-progressive damage to the upper motor neurons. Question 30. Which statement about Duchenne's muscular dystrophy is most accurate? Daughters have 50% chance as carriers, sons 50% chance of disease. Both have a 50% chance of developing the disease. Each child has a 25% chance of developing it. Sons only have a 25% chance of developing it. Duchenne's is an X-linked recessive disorder. A carrier mother has a 50% chance of passing the affected X to her sons, disease, or daughters, carrier.